Hi, Mrs. P, how are you today?
Fine.
Can I call you Thelma?
Yes, you can.
Okay. Well, what brings you to my acupuncture clinic today?
I have arthritis bad and I have neuropathy
Okay.
and I'm in pain.
All right. Have you been to a regular MD and received a diagnosis for your arthritis?
Yes, rheumatoid arthritis.
Rheumatoid arthritis. All right. Is the pain on a scale from 1 to 10, how would you rate the pain?
10.
A 10. Okay. Is that all the time?
Most of the time.
And how long have you had this condition?
35, 40 years.
About 35 or 40 years. Okay. Well, let me ask you a few questions about your arthritis and your numbness. Where is the numbness and the pain mostly?
In these 3 fingers and this thumb is the numbness, and my feet.
Okay.
My feet and up my legs to about here.
Is the pain fixed? Or does it move around?
No, it stays in my feet and in this hand.
Okay. And I can see by looking there's not a lot of swelling or redness right now, right? But you do have limited range of motion. Okay. Is it relieved by heat, your pain?
The only relief I can get is like get in the bathtub with my feet and turn the hot water on.
Warm water, okay. And does it usually get worse in the winter time, in the colder weather?
No.
It's pretty much the same?
It's 24/7.
Okay. And your range of motion is obviously limited there.
Yes.
Would you say you have more pain or numbness?
It'd be numbness.
In the winter time, is it worse in the winter time? Or
No.
No, it remains the same throughout the year? Okay. Do you have any feeling, does it feel like you have a heaviness sensation going on? Does it feel kind of heavy?
Sometimes it feels more than others.
That's probably with the numbness. All right. Now, if I touch it, is there pain on pressure or anything like
No.
that? No? Okay. Is it worse at night?
Yes.
It is. All right. I can see that you've had some recent surgery.
Yes.
And tell me about that real quick.
Well, I had calcium build up in my shoulder and had to have
Okay.
surgery.
Well, that's probably a result of the arthritis too. All right. Well, what you have is a painful obstruction syndrome, and I think what you have is a combination of what we call cold, damp, and chronic B syndrome in Chinese medicine. All right. Let me go ahead and look at your tongue. Okay, and let me see your pulse here. Let me feel your pulse. Okay, good. All right, we're going to go ahead and do some acupuncture and give you some herbs to take at home too. And I'm also going to give you some dietary recommendations. So we're going to give you the full treatment here. 8 acupuncture points were selected for this case. Kidney 3 and liver 3 were selected because they are yuan primary points of their respective meridians. They are considered the most important points on the channel because this is where the qi emerges. They have a close relationship with their related internal organs, in this case the liver and kidneys. They are best to tonify and harmonize the kidneys and liver to treat the root of the disease. Tai Chi and Tai Chong are also shoestring points, and according to classical Chinese acupuncture, are indicated for heaviness in the body and painful joints. 3 master tongue points were used. Xiaojie, which means small joint, is located on the lung meridian at the side of the first metacarpal bone. In this case, it was used for pain in the shoulder, ankle, and hand. Shou Wu Jin and Shou Qian Jin were selected and used as Dao Ma or coupling points in Master Tong's acupuncture system to increase the therapeutic effect for relieving pain and numbness of the feet. They are located on the lateral side of the ulna, approximately 6 to 7 inches from the wrist crease. Large intestine 4, or Hegu, was used to tonify the defensive qi of the body and to promote qi and blood circulation to stop pain. Luo Jin was selected to stimulate qi and blood to stop shoulder pain and arm pain. And finally, Zhongju or Sanjiao 3 was needled to increase flexibility of the finger joints, pain of the upper arm and shoulder, and numbness of the forelimb. In this case, the patient came to our clinic with a diagnosis of rheumatoid arthritis from her MD. However, from a TCM perspective, it was easy to see that the disease was in fact painful obstruction syndrome, or Bi-Zheng in Chinese medicine. The differential diagnosis was painful obstruction, or Bi-Zheng, due to cold, damp, and chronic B. As an older patient and due to her chronic condition, she also presented with kidney and liver deficiency. Her recent shoulder surgery also added additional qi and blood stagnation and qi and blood deficiency due to blood loss and diminished food intake before and after her surgery. The formula Huang Qi Guizhi Wu Wu Tong, or Astragalus and cinnamon 5-twig substance decoction, has the following base herbs. They are Huang Qi, Radix astragali, Grey Jur, Rimulus cinnamomi, Bai Shao, Radix peonii alba, Shengzhang, Rhizoma zingiberis recens, and Da Zhao, Fructus jujube. This formula is designed to treat painful obstruction syndrome. Additions include 15 other herbs to open the channels and collaterals, move qi and blood in both the upper and lower extremities, thereby relieving pain and numbness, tonify the kidney and liver organ complex, drain dampness, and neutralize and balance the other herbs in the formula. The patient was given 2 packets of the formula with instructions as to how to decoct into a tea and drink at home. She was advised that the course of herbal therapy may involve many packets of herbs and that she would have to return to the clinic for evaluation and possible modifications to the formula.